my role in the healthcare community and being an advocate as far as prevention and helping people as far as disease prevention and helping to stop the progression of chronic diseases. I plan on becoming a certified asthma educator. I've done lots of research about certified asthma educators, and as far as their role in the community, it's to educate and to help prevent unnecessary hospital stays, emergency room visits, deaths associated with asthma. The salary range of asthma educators usually range between $19 to $35 an hour, depending upon your degree. Usually, when your degree is either in respiratory or nursing, it ranges between $19 to $35 an hour. Pharmacists usually are certified asthma educators. They're on the upwards of $55 to $60 an hour. The way that I would make sure that my patients stay compliant is actually go out into the communities, have workshops, do demonstrations on the correct way to use the inhalers, which inhaler is for preventative, which is considered the controller, which is for acute exacerbations, which would be the rescue drug. I would actually show them how to use these medications, when to use the medications, how to be compliant, the importance of compliance. Um, Also using a spacer, starting a program to actually give free spacers out to them. I would also make age appropriate education visuals for adults as well as pediatrics. Pediatrics tend to learn better with visuals, so I would have visuals. Adults tend to learn better when you use more simpler terms and not medical terms, things that they can understand. Educating them about asthma, letting them, instead of saying, for instance, inflammation, say swelling. Instead of saying phlegm or mucus, say snot. Um, Talking to them as far as the importance will actually help prevent further diseases that asthma complicates. Um, Congestive heart failure. COPD is also another aspect of asthma, you can say. It's chronic obstructive pulmonary diseases, which can, it's under an umbrella. Chronic bronchitis. Most of these people with COPD originally have asthma, um, and all of them would basically fall under that umbrella. And that's what my role would be as an educator. I feel that giving back to my community with a lot of the other things in the programs that I talk about, that I'm talking about implementing, I would not necessarily receive compensation. Most of it would be free, and it would be more of an outreach for them. So everything you do is not necessarily always followed by compensation. Sometimes it's just followed by the reward of knowing that you're helping people, especially with something with a disease that's 100% preventable. I do know, have some background on asthma, and I guess that's why I'm probably pursuing the bachelor's in this field, because I am already currently a respiratory therapist. So I guess I do have a passion for pulmonary. I do have a passion um, for lung disorders, and we see so many things, and for asthma to be something that is 100% preventable, 100% preventable. I mean, why not do something to go out to reach these children and these adults and these families and try to cut down on the mortality rates of a disease that's so preventable? Um, I also plan on trying to reach school nurses to help them be in compliance and partnership with me as well. And that's it.